Across the world, millions of individuals struggle with conditions like ADHD.
People say that ADHD diagnosis is pointless, labeling yourself. Do you know that not being diagnosed can lead to some pretty serious consequences? 2 times as many relationships fail when one of the partners has ADHD. Literal jail. Research suggests that between 25 and 45% of people in prison would meet the diagnostic criteria for ADHD. Secondary to that, not achieving your academic potential, not achieving your career goals.
It's anger and sadness as well, that, well, it could have been different for me, or I could have had less of a challenging life. When you're dealing with an adult patient who's diagnosed later in life, you have to help them process all that anger. You have to also help them process all that sadness. Lots of their memories, core memories at those stages in their life when an ideal world would be full of happy memories that you can reflect on, they're really negative. If we look back, it's ADHD.
Autism.
I still had those moments of sadness for that little girl who grew up thinking that she was just stupid and that there was something wrong with her and she was fundamentally flawed.
Why didn't they take me to a psych when I was a kid? Why did I have to go 28 years feeling misunderstood? It felt unfair, and I was angry because it seemed like nobody cared to get me help. And they just blamed me for things that I didn't do, and then acted like I was a problem instead of being curious about what I was struggling with. So I sat with that anger, and then it turned into grief.
I have right now is unfortunately I had to cancel a bunch of stuff because I felt quite ill with or possibly like psychosomatic things due to, again, very late diagnosed autism. So I think fatigue, nausea, dizziness, stuff like that. And I feel like I don't exactly, at least where I'm from the Netherlands, I don't see a lot of recognition regarding those things, like how untreated or at least unrecognized autism can lead to long-term physical issues as well.
And Alzheimer's disease.
Rate 99.6% of Alzheimer's drug trials fail. That's worse for any other condition, and that's just because by the time you've arrived at that diagnosis, you've got amyloid plaque buildup in the brain, the degree of hypometabolism, meaning the brain's ability to generate energy from its primary energy substrate, glucose, is already diminished by at least 50%. There's typically marked shrinkage in the brain, so it's a condition that we really need to be talking about through the lens of prevention.
Patients with these 3 disorders often facing delayed diagnosis, subjective assessments, and limited access to continuous care. All those issues are solved by introducing Brainora, an intelligent, multimodal system designed to support faster, more objective diagnosis and intervention. By combining AI, affordable wearables, and gamification, Brainora delivers accessible and continuous cognitive assessment. We begin with our real-time data curation pipeline, enabling continuous ingestion and pre-processing of multimodal data. Raw video inputs are uploaded and processed using YOLO, converting them into structured motion key points. In parallel, standardized assessments such as AQ and ASRS forms are digitized as baseline behavioral inputs. After filling out the form, the game can be accessed online. The user selects a motion-based game. And the recorded video is then converted into a CSV file before being sent for motion detection, ensuring the user's privacy is preserved. The clinician uploads MRI data, forming the neurological foundation of analysis. Then, the child interacts with a friendly AI avatar, introducing a gamified screening experience.
Yes, my name is Abdullah.
Hi there, I'm Brainora. I am so excited to play a game with you. Let me know once you're ready to start.
Yes, I'm ready.
A movement-based game captures behavioral signals in real time, transforming observation into measurable data. During a resting state session, affordable wearable devices collect EEG and physiological signals. These enable continuous health monitoring beyond the clinic, making the system scalable and practical.
Awesome! Bear with me for just a minute while I get everything ready. I'll be very quiet while I work. Aha! I'm back. You did an absolutely awesome job today. I've sent all the details from our session to your caregiver's email address so they can see how well you did. I've also scheduled our next playtime for 1 week from now, and you'll get an alert on that day. Thank you so much for playing with me. I wish you a beautiful day. Bye-bye.
This is the received email. And this is the intervention game for ADHD. And this is the intervention game for ASD. As highlighted by clinicians we collaborated with, Brainora has the potential to enhance diagnostic efficiency and provide meaningful support for both patients and professionals by bridging AI and clinical practice. Brainora enables earlier detection, faster diagnosis, and smarter intervention, all in one unified platform. And here is the feedback from the doctor.
After seeing your program, honestly, I found it very impressive. It is something that feels almost unbelievable. Brainora shows how a specialist, doctor, or diagnostician can save time and effort while getting stable results and readings that are closer to the child's real condition. This is extremely important because the biggest challenge in diagnosis is time. Normally, it can take from 6 months to a full year just to understand what is really happening with the child and reach a clear diagnosis. Unfortunately, all this time is taken from the child's developmental age. For example, if I spend months only doing evaluations, tests, and assessments, this means the child is losing valuable time without starting the actual intervention. Brainora can be very helpful because it shortens this process, supports early understanding of the case, and saves time for both the specialist and the child.
طبعا احنا هنا ممكن كل طالب او كل طفل موجود عندنا كل كيس يكون ليه فايل زي ده، وبناء عليه نقدر ناخد القراءات بتاعته عن طريق الابلكيشن. نقدر نشوف تطور الخطه بتاعتنا ماشيه ازاي، هل التطور ماشي مش بس بلاحظها بمجرد الملاحظه، لا انا كمان ممكن اشوف التطور بتاع الطفله من الطفل بتاعنا اللي موجود معانا في المركز من خلال القراءات اللي موجوده. فممكن اخد الابلكيشن كل 3 ايام اعمل له اعاده تاني، اشتغل عليه، اشوف الطفل وصل لاي مرحله معايا، وبناء عليه انا كده بطور في خطتي، بشوف تاثير الخطه هل هي صحيحه ولا غير صحيحه في البرنامج، وفي نفس الوقت بقدر اخد الجايد لاينز الخاص بالبلان دي. يعني مش مضطر ان انا اعمل اعاده تقويم كل 6 شهور او كل 3 شهور او كل 6 شهور اللي هي المده البيزك اللي احنا خلاص بنحطها للخطط بتاعتنا. لا، ده انا ممكن كل 3 ايام اعمل قراءه مختلفه.